Topic of my presentation is infertility in sheep and goats. So infertility, as we know, it's studied very commonly in case of large and ruminants like cattle and buffalo. But in case of sheep and goats, no much importance is generally given. We all know that reproduction is a very complex process and it involves many physiological events like we have the interaction of CNS, hypothalamus, pituitary gland, gonads, and then the target organs. These all act in coordination. And in case of the females, we have the estrus and ovulation, whereas in case of males, we have the production of semen. And if there is any disturbance in any of these events, like a failure or a delay in any of these functional events, can result in infertility. Also, there are other events which are associated with fertility. We have the terms like subfertility and sterility. We all know that sterility is like complete absence to produce a viable offspring. The subfertility is uh, reduced. The capacity is there, but it's reduced. And now coming to the infertility. So infertility lies in between the subfertility and the sterility. So we have diminished or absent capacity to produce a viable offspring. It can even be reversed if possible, but generally the prognosis is good if the treatment is done at an earlier stage. Also, another definition of infertility, which we can like put it in different words, like temporary disturbance in reproductive function, wherein the animal cannot become pregnant. So the ultimate outcome of infertility is that there is no viable offspring produced. In case of polytocous species, like the species which give birth to more than one number of fetus, even a subnormal number of offspring is also considered under infertility. For example, we have swine or we have even sheep and goat also, where we expect like more than two or three offspring to be produced. And if in cases where the number of offsprings is reduced, for example, we have a swine which produces only one offspring, so that will also be considered under infertility. So infertility actually, as we all know, because the female bears the offspring, so the success or failure of reproduction is generally reflected on the females. However, the infertility is generally contributed both by females as well as the males. So infections or any conditions that reduce the ovulation rates, fertilization rates, embryonic survival rates, fetal survival rates, or perinatal survival rates, all of these events will lead to infertility. Coming to the female part, the contributors to infertility are if the female animal fails to cycle or there is failure of the estrous cycle, if there is any aberration in the estrous cycle, there are irregular estrous cycles, for example, if there is a failure to conceive or a prenatal or perinatal death of the conceptus, all these factors will contribute to infertility. And coming to the male side of this infertility, we have the disturbance of the production, transport, and storage of spermatozoa, aberration of libido, and physical problems which result in complete or partial inability to mate. Any of these events, if is not exhibited, will lead to infertility. So when we tackle infertility, we have to look for many sides. It's a very complex, the etiology is complex, the pathogenesis is complex. So when we go for diagnosis and treatment, we have to look at all the aspects and then move to its diagnosis. So infertility generally in case of sheep and goats is considered uncommon when compared to the other domestic animals. This has mainly two reasons. It's uncommon. It's said that it's uncommon because maybe that it's not that deeply studied till now. And the second thing is that the as we all know that sheep and goat are reared for milk, meat, and wool. So if the animal is found infertile, if any sheep or goat is found infertile, the owner generally goes for prompt elimination of that animal, either by slaughter or he will like sell it to some other person. So that's why, and this infertility is generally not that pronounced, or as we can say that we are not able to see that much cases of infertility, or it's not that much reported. Also, we know that infertility, as it's a very common reproductive problem, it's a very major reproductive problem. So it leads to the economic loss to the farmers. We know that the farmers who keep the sheep and goat, they are generally in the developing countries, and mainly the small marginal farmers, they keep these small ruminants. So if there is any loss of production, for example, meat, milk, or wool, all of these will lead to the economic loss to the farmer. We all know that production is directly related to the reproduction. So if the reproduction is not well, then the production will also be hampered. So we should go like that. So this loss in productivity ultimately leads to the economic loss to the farmer. Also, the owner, when is maintaining an unproductive animal in terms of reproduction, he will also incur losses. So that's generally that cost of that maintenance of that animal is very high for that owner to bear. It is generally said that ideally, for to be considered as optimum fertility, the three lamb or three kid crops in 2 years should be exhibited. Like sheep should be able to produce, give us three lambs in 2 years, or similarly for the goat, and then also then only we can say that the animal is fertile. Now coming to the reproductive characteristics of sheep and goat, we all know that although the morphology and the things are similar to that of the cattle and buffalo, but we have certain very major differences in terms of other reproductive characteristics. So coming to the age at puberty, the sheep and goat both generally sexually mature at 6 to 8 months of age. Uh, and in case of the length of estrus cycle, the sheep generally have a shorter estrus cycle of about 14 to 19 days averaging to 17 days, whereas the goats generally have a length of estrus cycle of 18 to 22 days with an average of 21 days. The duration of estrus in case of sheep is 28 to 36 hours. It's shorter than the goat. In goats, we have 32 to 40 hours duration of estrus. Similarly, for the time of ovulation, the time of ovulation is generally 24 to 27 hours after the estrus onset in case of sheep, which is earlier as compared to the goats, as they have a longer estrus cycle. So that's generally 30 to 36 hours after the onset of estrus. So the breeding, the time of ovulation is very important for the breeding to be done. Also nowadays, where in some cases owners go for AI also. So that in that time also the duration, the time of ovulation, everything is very important to be kept in mind. The reproductive physiology of sheep and goat also differ from each other in certain some way, some play at some points, not at all the criteria. So the age at puberty. So that's generally the age at which the animal will sexually mature. So we all know that sexual maturity, it varies with the breed as well as the rate of growth of animals. We say that for the animal to be sexually mature, it should have achieved its 60 to 70% of its adult body weight in order to be sexually mature. So the sexual maturity in case of sheep and goat varies with breed also and with the rate of growth of animal also. The high plane of nutrition will hasten the onset of puberty, and also if the plane of nutrition is poor, then the onset of puberty will be delayed. It's said that in case of the crossbred breeds of sheep and goat, they mature earlier than the purebred. So if you have a crossbred sheep, that will mature earlier than if you have a purebred. Also, the fine wool breeds, they are slow to mature. In case of goats, we have pygmy goats, which are little short goats. They mature even earlier, like they have a puberty around 3 months of age, which is very earlier to its normal time of puberty, that's around 6 to 8 months. Coming to the estrus cycle and ovulation. So this is a very, very major point which stands out, is that in case of domestic animals, that's the Sheep and goat, they are seasonal polyestrous, or they are photoperiodic. They exhibit photoperiodism. So they are seasonally polyestrous and they generally breed during the short days. So they are known as short day breeders. We also have another domestic animal, that's the horse, which is a long day breeder, and that's also seasonally polyestrous. So whereas in case of the cattle and buffalo, we don't have that seasonality. So photoperiodism is actually nothing but a characteristic of the reproductive cycle and sexual activity of sheep, goat, also of the horse. But as our topic doesn't go there, so that's why I've not mentioned it. Estrus is so what does photoperiodism mean? It means that the estrus is generally controlled by the hours of light to which the eve or doe is exposed. So if you expose, as you know, they are short day breeders. So if you give them short days or the length of the daylight is less, then the eve will be able to exhibit estrus. What happens is that during the breeding season, before the beginning and after the end of this breeding season, so the breed, as you know, they are seasonal, so they will have a breeding season. So before the this breeding season begins and after the end of this breeding season, it's not like that the animal is not exhibiting estrus. The animal will exhibit estrus, but those estrus will be silent, and or there will be ovulation without the estrus. We can say it like that. So there is no exhibition of estrus signs, whereas ovulation will happen. So keeping that photoperiodism in mind, it's said that if you reduce the daylight to about to 10 to 11 hours, either naturally or inducing it, then the estrus can be exhibited by the sheep and goat. As this is what we discuss about the this is what we think we are discussing about the female uh, side of the sheep and goat, but in case of the rams and bucks also, that's the male side, there's no seasonality, there's no restricted breeding, like they are active throughout every season. However, it's been found that during the breeding season and during the non-breeding season, in between them, there's a slight variation in semen production and characteristics. So the semen production and characteristics are better in the breeding season as compared to the non-breeding season. That's why that this point also has to be kept in mind. Even though they don't exhibit seasonality, but they exhibit a variation in their semen production and characteristics. So this is a pictorial representation of the like the seasonality and the anestrus in case of sheep. A sheep and goat also. The picture only shows sheep, but it's for both. So as we know that the fall season, that's our autumn, which is now in places. So we have the autumn where the mm, daylight is less. So then this is the time when the eaves will have their estrus breeding season start. So the mating will happen during this breeding season. Pregnancy will take place during this, and the animal will give birth at the time when it's spring. So it's known that during the spring we have abundant uh, feed resources, like the plants are maturing, and so that's why the animal generally gives birth during the spring season, and then the animal after giving birth goes into an anovulatory or anestrus stage, and this they generally resume this again in the next fall, that's the next autumn or the winter. So the breeding season of the sheep and goat is generally the autumn and the winter. So it's known that near the equator, or the lines, the countries which are near the equator, they are less sensitive to seasonal effects. So those countries will not show any seasonality. So as you know that India lies, the equator doesn't cross India. So we have seasonality here. In the temperate areas of the world, so the temperate areas are also the north of the India. In the temperate areas of the world where the four seasons can be differentiated, like we have a differentiated spring, summer, fall, winter. So in those areas, the spring and summer is the non-reproductive state or the non-breeding season, and the fall and the winter, as I already told, is the normal cycling or the breeding time of the sheep and goat. And in this fall and winter, the peak breeding season is generally our September to January time. Also, it's known that the wool breeds. of sheep, they have a longer estrus period as compared to the meat breeds. One more important thing is that it was found in case of certain eves that when the uh, animal was slaughtered and their endometrium was looked at, the endometrium in some eves was black due to the presence of melanoblastic pigment. So this melanin is what is like is responsible for the photoperiodicity. Now coming to our topic and the causes of infertility. So etiology of the infertility is very complex. Also the pathogenesis is equally complex. And the etiology, we generally categorize it broadly into like environmental, structural, functional, and infectious causes of infertility. We will go one by one into the topics. Coming first to the environmental causes, we have major three categories to which this environmental cause is divided. We have seasonality and photoperiodism. So seasonality and photoperiodism, which leads to infertility. Then we have nutritional abnormalities, and then the heat stress. So, as I have already discussed about the seasonality and photoperiodism, that during they have a breeding season and a non-breeding season, and during their non-breeding season, they are generally in a state of infertile, you can say. So, in the nutritional abnormalities, we have certain plants. So, as these animals go for grazing, so there are certain plants. Also, when the grains are kept inside storage, so certain plant toxicity is observed. Like we have some ergot alkaloids, and the ergot is nothing but a fungus alkaloid causing fungus. So it's the consumption of the grains which are infected with this fungus, they result in decreased reproductive efficiency. So these ergot alkaloids are generally having an impact on the reproductive efficiency, negative impact. Coming to the next one, that's the estrogen producing plants. So we have some estrogenic plants which produce permanent sterility, or we call it permanent phytoestrogenic sterility. So sheeps are generally sensitive to the effect of phytoestrogens from growing plants such as Mediterranean clover, that's trifolium. Then we have white clover also and alfalfa. Out of all these three, the subterranean clover is very considered very phytoestrogenic active. So the compound that's present in case of these clover is the isoflavone derivative, and it's been named genistein. It also has a chemical formula, and this genistein is almost 1/5 time as potent as estrone. So estrone is nothing but a derivative of the, we call it estrogen. So this estrone, uh, this genistein has 1/5 time as much potency as estrone, and it's said that around 100 mg of this genistein is found in 100 gram of subterranean clover. So this one is having phytoestrogenic effect. So as you know that if the estrogen levels are high, so the animal will not be able to establish pregnancy. It's also one good thing is that the amount of estrogenic activity is more in case of growing plants when the plants are growing. Whereas if the pasture has matured, then the animals are at less risk to this phytoestrogenic sterility. So what I was saying about that ergot, so this is this black color, you can see this is the ergot. And then we have this subterranean clover. This is a photograph of the subterranean clover. You must have seen it, I'm sure. Then coming to the next part of aspect of nutritional abnormality, that is the decreased energy, mineral and vitamin intake. So this one is mainly concerned with the plane of nutrition you are providing to the animal. So if the nutrition plane is low, then the animal will have a poor body condition, and this poor body condition will lead to reproductive activity suppression. So the main things will be there will be a delay in puberty, or there will be depressed ovulation and irregular estrous cycles. Mainly the uh, part that leads to this poor body condition or the reproductive activity suppression is the TDN. So the total digestible nutrients should be high in the diet of the animal, even prepartum and postpartum also. If the TDN is low in prepartum and postpartum diet, the fertility will suffer. Also, not all vitamins, but yeah, like there are some very major vitamins which are related to infertility. So, it's known that vitamin B12, which has a direct connection with the cobalt. So, if the vitamin B12 levels are low, then there will be a deficiency of cobalt, and then the number of human bacteria will be reduced, and thus the digestion will not be proper, and the animal will not be able to assimilate the nutrients, so leading to the problem, poor body condition. Also, copper, vitamin E, and selenium deficiency. They are known to have a very important connection with the infertility and in the irregular estrus. Also, low phosphorus and low protein together. Low protein itself doesn't lead to infertility, whereas low protein along with low phosphorus will lead to infertility. So, in terms of the nutrition and the body condition, it's generally said that body condition score of 3 or more should be there during the breeding season. So, then only the fertility will be maximum. Even mm, during the non breeding season, also the body condition score should be between 3 or it should be more than 3. But obviously, the animal should not be obese. And the last aspect of environmental cause, that's the heat stress. So, heat stress generally includes a lot of points. We have humidity, we have wind speed, solar radiation, air temperature, then it's the animal's metabolic heat production. All these will together form the heat load. So, if the shearing is done in summer, so that direct exposure of the skin to the heat will also lead to the heat stress. In case of transportation and when the animal is obese, if the animal is taking less of water, will all predispose the animal to heat stress. So this heat stress will depress the reproductive ability. Also, if the animal is pregnant and exposed to heat stress, there may be fetal wastage. So heat stress generally leads to endocrine imbalance. So we have the GnRH amplitude, it decreases, and also other hormones which are associated, like there will be low levels of LH because LH is directly linked with the GnRH. Also, it's said that the endocrine imbalance also leads to lowered levels of progesterone, thus resulting in the fetal wastage. So sheep are generally tolerant to external temperatures of more than 110 degree Fahrenheit, but the humidity should be less than 65. If the humidity is also more and the temperature is also more, than that's not a good sign. Also, the sheeps, when their rectal temperature goes above 106 degree Fahrenheit, they start panting, and that panting will help them in balancing this heat stress. And now coming to the structural causes, the structural causes they generally include structural defects of the genital organs. So, and these structural defects are generally not that common in case of the small ruminants. So, we have certain major structural causes like the free martinism, where a female is born co-twin with the male, and it's sterile or infertile. But this is not that common, but and incidence of around 1.1 to 2.3% is reported in case of the small ruminants. The next major thing is the intersexuality, and this intersexuality is very highly found in case of goats. And we have the male pseudohermaphrodites, which are commonly found. So male pseudohermaphrodites are nothing but they are males, but they have female organs also. So intersexuality, this generally happens because of recessive character, that's some gene, and which is recessive. And in case of goats, it's said that the intersexuality is associated with hornlessness. So the goats which are hornless, they are generally they are like more susceptible to this intersexual producing male pseudohermaphrodites. So one common practice among the farmers is that the hornless goats are generally bred with the horned goats, so that this pseudohermaphroditism can be reduced. Also, the occlusion of oviduct and hydrosalpinx, this will all result in infertility, metritis, perimetritis, that's the inflammation of the uterine layer. Then adhesions in the uterus, coming to vaginitis, that could be either non-parturient or parturient, like after parturition or without parturition. Like then ovarian tumors, these are rare, but we have a very major one, that's the granulosa cell tumor, which is very common in case of small ruminants. So granulosa cells, they are generally producing FSH. So we have nymphomania. Uh, these are characterized by This type of tumors are characterized by nymphomania, and also they will be observed as enlarged, like the ovary will be appear enlarged on the ultrasonography when done. So these are some pictures. Like this is the intersex goat. In this, they found that the external genitalia, like it appeared to be a hermaphrodite. It was not clearly, and also there was no presence of prepuce. However, the animal behaved like a buck, and it also was mounting on the doors. And next picture is the bilateral bursal cyst. You can see there's a fluid accumulation in the ovarian bursa, a lot of fluid. And then the last one, that's the granulosa thicker cell tumor, which I was talking about. You can see this enlarged ovary. Now coming to the functional causes of infertility. So two major ones, those are the anestrus and subestrus. Like they are anestrus, subestrus, they all have become a synonym to the infertility. So anestrus or subestrus, this could be due to either ovarian hypoplasia, ovarian aplasia, ovarian atrophy, anything. So due to which the cycling is not normal, estrous cycling is not occurring. Also pyometra. If there is pus in the uterus, this generally happens due to persistent CL, and there is a cessation of the estrous cycle because of this persistent CL. So that also leads to infertility for time being until it's resolved. Coming to cystic ovarian disease, it's more common in case of goats than sheep, and it's the COD is generally associated with phosphorus deficiency. The reason of it is like still under research. Also, it said that feeding of estrogenic compounds also predisposes the animal to cystic ovarian disease. Next one is the mummification. So mummification is like we have a sterile mummy inside the uterus. What happens in mummification is that there is a persistent CL, and that's why there's a prolonged luteal phase. So even if it was found, if owner says that my animal was pregnant but it has not parturited and the gestation length is increasing day by day, it could be suspected for mummification. One more important uh, cause, that's the pseudo pregnancy, and this one is mainly in case of goats. Can also be seen in sheep, but mainly in case of goats. It's also called mucometra, hydrometra, or cloudburst. So in this case also there's a prolonged luteal phase in the goats, as there is persistent CL. The owner thinks that the animal is pregnant, but that's not the case actually. It's just the persistent CL. Also, there will be enlargement of the abdomen, like the animal is pregnant, and its incidence in dairy goats is more, like 3 to 5%. Whereas in case of meat or fiber breeds of goat and sheep, the incidence is very less. So this is the cystic ovarian disease. We can see this one. This is a cystic graphene follicle. Also, the uterine wall thickening in this case. Hmm. And this one generally depicts perimetritis. So these are the uh, tubes, uterine tubes, and then we have bilateral hydrosalpinx. These tubes are filled with the fluid. Then we have cystic follicles, like here also you can see, and then we have perimetritis. Coming to the infectious causes of infertility. So infectious are generally which are associated with any disease. So diseases are generally due to bacteria, virus, protozoa, or fungal infections, and those diseases which affect the genital tracts. So those are the major like causing infertility. So we have, as we all know, we have brucellosis, leptospirosis, toxoplasmosis, Q fever, listeriosis, campylobacteriosis. All of these are associated with infertility. But also it has been said that all the diseases, they are generally associated with abortion and less with infertility. What happens is that when these diseases result in abortion, after the abortion, the as you know that the sheeps are seasonally cycling. So after the abortion, the sheep get a lot of time to recover from that disease because they have that period of anestrus in between the breeding seasons. So these diseases, whatever are mentioned like brucellosis, leptospirosis, toxoplasmosis, Q fever, listeriosis, campylobacteriosis, all these are more associated with abortion than infertility in case of the small ruminants. One major disease, that's urea plasmosis. So that's caused by urea plasma. This is spread by venereal transmission, and this disease is the one which is the major cause of infertility in case of sheep and goats. So the clinical sign is that there will be granular vulvitis, and the fetus which are born are of low birth weight. So urea plasmosis is of significance in case of the small ruminants. And the infections which other than the postpartum infections are seldom a cause of infertility in case of sheep and goat. So these are the diseases which I discussed earlier. The brucellosis, as you can see, it's a common cause of abortion, and then there it causes infertility also. Along with that, we have Q fever also, abortion, infertility. Then we have the trypanosomiasis causing abortion, the campylobacteriosis also, similarly the list. Now coming to the diagnosis of infertility, as you know, the causes or the etiology is complex, so the diagnosis will also be a little complex. So in terms of like diagnosis, you have to go for anatomic, that's the structural and functional soundness of both the male and females, not only the female, but the male and female aspect uh, should be studied, the anatomic and functional soundness of both the sides. So it will be assessed by the history, by signs and symptoms which are exhibited by some signs and symptoms are easily like noticeable, but others will not be that easily noticeable. In that cases, you will have to go for clinical examination. Also, you have to employ certain diagnostic aids like ultrasonography, laboratory examination for like hormone assays, serology, cytology, microbiology, and other. In case of males, you have to go for even semen evaluation to uh, find the root cause. After the diagnosis, we have the treatment and the management aspect of infertility. So if you are able to clearly diagnose a disease, then you can go for its treatment. Otherwise, the infertility is generally managed. So we will go, as we studied the causes, we will go for the treatment or the management. First, coming to the seasonal anestrus, which we see in case of these animals. So, in we have to overcome the seasonal anestrus. For the overcoming the seasonal anestrus, the researchers they have come up with various methods. Mainly, we have two. That's the natural and the pharmacological method. So, in case of the natural method, we have the male effect, or we also call it the ram effect or boar effect. That's the first method, and second one is the light and dark ratio. As you know, this deals with photoperiodicity, so that's why. Next one is the pharmacological method. We have the progesterone method, prostaglandin method. These are hormones, and the melatonin implants. So these are also employed in case of seasonal anestrus, overcoming this. So dealing one by one, we have first the male effect. That's the ram effect or the buck effect, as per the species. So this is generally done during the transition period. That's when the animal is moving from the non-breeding to breeding season during that time. So, or the breeding to non-breeding season during the transition period, not during the breeding season. You should not be doing this ram or buck effect. Like you can do it, but it's like we are generally talking about the overcoming the seasonal anestrus. So eaves and goats, they for this ram effect to actually like produce effect, you have to ensure that the eaves and goats they are kept away from the rams and bucks for at least a month. Like you should keep keep them separate. Like eaves should be separate from the rams like for at least a month without doing before doing this effect. Also, When you are preparing the ewes and goats artificially, you also have to prepare the ram and buck artificially for that seasonal treatment. Like either you can go for light treatment or melatonin, because seasonality will be there, affects them their characteristics also. Coming to the light and dark ratio, that's the next part. We have generally said that a light exposure period of around 12 to 14 hours is like important. You can also decrease it, but this is the range, like 12 to 14 hours of exposure should be given. Then the rest is darkness. So artificial light, if you are giving it like in the normal season, it's fine, the winter season. But in case of the summer season, you have to create this effect. Like artificial light should be given like of 220 lux for around 30 to 120 days. So this is the Easter cycle in case of the normal Easter cycle, which we know that we have the estrogen which is low before the estrus, and then it starts increasing in the pro-estrus and peaks at the estrus time, and then decreases when the progesterone takes over and during the diestrus period. So that's the cycle. So the next method, that's the pharmacological method of this overcoming the seasonality. We have the progesterone method. So what happens in this case is that we go for implanting the progesterone, like, or giving it by like as sponges, or inserting it vaginal sponges like that, or we give an injection. So we have types of progesterone devices which are available. We have MAP, that's the medroxyprogesterone acetate, which contains 60 mg of progesterone, and these are generally, this progesterone is impregnated in the sponges. So, and next we have the FG, that's the fluorogesterone acetate. It contains around 30 to 40 mg or 45 mg, the dosage. And then we have the cider, we have 0.3 gram of progesterone in this small ruminant cider. The duration of this treatment. So as we know that the sheep and goat, they have a smaller estrous cycle as compared to the goats. So that's why the duration of treatment in the case of sheep and goat should also be less. So we will be going for around 12 to 14 days of this treatment, progesterone implant or insertion, and then in case of goats, we'll be going for around 16 to 18 days. And after this 12 to 14 days and 16 to 18 days, you will see that the animal will come into estrus within 2 to 3 days. So this is the protocol which is generally followed. We have one side sheep and goat. So as you know that 12 to 14 days for the sheep. So you insert the sponge on the 0 day, and then you remove the sponge on 12th day, and then inject PMSG with that. So, and after injecting that, you introduce a teaser ram to detect the estrus. And on the 14th day, you introduce the actual rams for breeding, or you do the AI. Coming to the goats, we generally wait for 16, we have a 16 to 18 days period. So we insert the sponge. We keep it for like 14 on the, keep it for 16 days. On the 14th day, we inject PMSG. On 1 day after also we inject PMSG, and then we introduce the, after removal of sponge, we inject PMSG. Then we, after 1 day, we introduce the teaser bucks to detect the estrus. And once we know that the goats are in estrus, we introduce the rams, or we go for their AI. So generally 12 to 14 days in case of sheep, and 16 to 18 days in case of goats. That's the duration of the progesterone treatment. Next one is the PGF2 alpha method. So this method is generally used in case of breeding season. So if you have sheep or goats which are not like, even in the breeding season also, they are not able to, they are infertile in the breeding season also, this is the method you can go for to overcome that. So we whereas in when the animal, if the animal is having like not having CL, the PGF2 alpha method is of no use. So this will only work in case of a persistent CL if it's present, or if that's generally in case of anestrus. So what happens in PGF2 alpha method is that we go for 2 injections of PGF2 alpha, that's lutalized. 9 days apart. So we give one injection today, that's the 0 day, and after at the ninth day we go for another injection, and after 2 to 3 days the animal will come in heat. So the prostaglandin analogs, which are generally used to synchronize, these protocols can also be used for synchronization of estrus. Suppose you have a farm and you can't be dealing with like now one animal is paturating, then another is paturating. So in order to overcome that, you go for synchronization of estrus so that the animals like they have a synchronized estrus, they paturate at the same time and everything. So the prostaglandin analogs which are used to synchronize these estrus are generally the lutalized, that's dinoprost, 15 mg, 9 to 11 days interval. And then we have the cloprostenol, that's the estomate, which comes as composition 125 to 150 microgram. Similarly for 9 to 11 days interval. And in case of dose, you can generally increase like 1 day, like more. It's 12 days interval. You should not be like, should not stop it at 9. No, suppose you are like giving the PGF2 alpha to a dose, so you have to wait for 12 days in between two injections. So this PGF2 alpha, what it does is that it causes the regression of the CL, and then it leads to the results in estrus. And the one more important thing, that's the melatonin implants. So as you know that photoperiodicity is generally due to melatonin. That's the hormone which is resulting in this photoperiodicity. So what happens is that of breeding season we go for melatonin implants. We give a subcutaneous implantation of this melatonin around 10 mg at the base of the ear of the sheep, and generally we administer one implant. Every sheep will get each one implant, and this is generally done for around 30, like you should keep the implant for around 30 to 40 days. So average of 35 days. Suppose you are implanting the melatonin today, so you have to wait for 35 days to 40 days, and after that you have to bring in the rams and bucks which will detect the heat, and you can go for AI or breeding. Coming to that management of heat stress. Heat stress, as I already told you, it's a cause of infertility. So heat stress, very, we all know that how we reduce the heat stress. We go for lowering the body temperature by cold water submersion. We put the animal in cold water as it's a small animal. We apply ice. We go for administration of cold IV fluids. And even if you keep the animal in shade also, then there will be certain reduced stress of heat. Coming to management of nutritional abnormalities, so nutrition is one factor which is having a very major effect on this uh, infertility or the fertility. So, and this is like the basic one which you can easily take care of. So at least the nutritional abnormalities can be easily taken care of by the pharma only. So the main thing is that there should be a clean and formulated balanced ration should be provided, like it should have the TD and CP and CF, everything whatever is needed, that should be prepared. Especially during the breeding season, the animals should be having like a good body condition score so that they can go for breeding like successful fertility. And then regular deworming should be done. Internal, external parasites should be taken care of. Then the grazing should be prevented. Like on the toxic plants or on estrogenic pastures, the animal should not be allowed to graze. So you can even go for stall feeding. And then one main thing that the nutrition takes care of, that's the ovulation rate. It is said that if you want to increase the number of ovulation or the ovulation rate in case of sheep and goat, suppose you want like a more number of offspring at a single cycle, then you need to have more ovas, and that more ovas can be induced by flushing. So flushing is very important part of the sheep and goat breeding. So flushing is generally what it consists of is that we increase the TDN and energy intake of the animal. So, and this has to be done for around 2 to 3 weeks. Like suppose your breeding season starts 2 to 3 weeks from now, so you should start the flushing today and you should have an increased TDN and energy intake. Should like energy in the ration should be more, like, so that type of ration should be given to the animal. So this will lead to increased number of ovulations and you will have a better crop. Now coming to the diseases which whose treatment can be done, like we have treatments which are specific to cause. Suppose like we have ovarian tumors, we can go for ovariectomy. So like if we like suppose one of the ovaries having ovarian tumor, we can go for ovariectomy and then let the other ovary start functioning. Next, if we have cystic ovarian diseases, so we for cystic ovarian disease we have luteinizing hormone. Yes, we can give LH around 750 to 100,000 IU, or you can go for GnRH 50 to 100 microgram, and this will subside this cystic ovaries. In case of pseudo pregnancy, which I told was very common in case of goats, you can go for PGF2 alpha injection. That's lutalized 1.5 ml. You can give intramuscularly, and also you should give antiprolactin because this prolactin is the one which assists in pseudo pregnancy. So for antiprolactin, we have the bromocriptine. So you should give one mg of bromocriptine for twice a day for 6 to 10 days. Then it's effective. Next is the mummification. Mummification, as it has persistent CL, you go for PGF2 alpha injection. That's lutalized 1.5 ml intramuscularly. In case of infectious agents, like we already discussed, the brucellosis, campylobacteriosis, listeriosis, etc., you can go for vaccination or any specific drug of choice. Like we have like for campylobacteriosis, we go for tetracyclines. Ureaplasma, we go for timolin. All those antibiotics of choice. Then segregation of the disease from the healthy animals. So the disease and the healthy animals should be separated so that you can prevent the spread of these infectious agents. So coming to the general management of infertility, like so from the basic, you should have a breeding strategy. The governments, they have breeding strategies. You should go for timely detection of estrus for females. In case of males, you should know the methods of semen preservation, then the insemination methodology. If you're going for AI, the care of animals should be done well, like their nutrition, everything should be taken care of. There should not be any heat stress or any stressors. The vaccination schedule should be followed. Then for reproductive pathogens, we can go for the reproductive pathogens which cause the infectious infertility that can be prevented or controlled with appropriate surveillance, biosecurity, and vaccination. Also, adequacy. We have like a human involvement in certain cases for when we go for estrus detection or when we go for semen preservation, insemination, etc., vaccination. In those areas, we have the involvement of human in the reproductive process. So in that time, you should know that the adequacy and quality of these techniques and procedures should be employed in management. Like there should not be any human error. Like so, the technique should be of quality and adequacy also. So finally, I would like to conclude my topic with the following statements. Like infertility is like having a complex etiology where like it can be either due to nutrition, physiological disturbances, or infectious causes, and all these causes may work separately or in combination. So positive improvements in nutritional management like photoperiodism and infectious causes in both male and female then can compensate these losses. Also, we should employ scientific knowledge and technologies like hormonal therapy for estrus induction during non-breeding season, use of USGs to detect the diseases, antibiotic sensitivity test in case of the like seeing which bacteria is causing the metritis or whatever will help improve the fertility status. Also, as you know that fertility production is directly related to reproduction. So better fertility will reduce the production loss and improve the economy of the farmer.